You're watching WECT News at 6.
Kids in Crisis. Tonight, a special look at treating children who have mental illness.
The cases keep increasing, but finding help can be very hard. Caitlin Stansel looked into who is now getting involved. Caitlin?
Fran and John, mental illness isn't a new problem, but it's one that is significantly increased, and it's showing up in children at younger ages. And in some of our counties, there just aren't enough resources for these kids or their families. Now school systems are taking matters into their own hands.
It's mental illness. It doesn't discriminate.
At just 5 years old, Janet Wall's son was diagnosed.
Got to a point where we thought, okay, we've got to really do something. He was feeling really down on himself, and he was talking about how he would have been better off if he were dead, that we should have never had him. He would have been better off if he was not born, and he was crying and sobbing. It was like an emotional meltdown for him. And for a 5-year-old, that's not typical.
She says on a daily basis, she's waiting on her phone to ring. A call from school or summer camp saying her child has had another outburst.
You just never know what's going to set him off.
But Janet has come to accept her child's special needs and to teach others about the illness that many have a hard time understanding.
We don't always know how to handle him. It's kind of a trial and error thing, and it's something that we've learned over the years, and sometimes we feel like we're failing, but we're doing our best.
Their best to find the resources they need to give their son the greatest possible chance at a normal life.
If he had had cancer, God forbid, or diabetes, we would be getting the services that we need. But because it's mental illness, people automatically, and insurance companies are number one. It's not recognized.
From 2013 to 2014, workers' compensation claims involving teachers hurt by students in Brunswick County schools jumped some 10%. From 48 to 66, and almost all of those incidents happened in the elementary school setting.
This is just one piece of data that demonstrates that we have a concern that we need to look at and we need to try to find a solution for.
And the solution they're talking about involves a day treatment program, a separate learning environment for kids clinically diagnosed with a mental illness.
If you take them out of the academic setting to provide those mental health services, then you really aren't dealing with what some of those triggers are, what those situations are that cause the disruption. So we need the students to experience what they would normally experience in life as a part of their mental health service.
Officials and families say this kind of program is desperately needed in Brunswick County because there just aren't any other places that can give their child the treatment they need.
They don't have the means to get there. They may not have the monetary means to get there. One of the other concerns that we have is sometimes, even though there might be some services available, they're limited in scope and they're limited in access.
But the concerns don't just focus on the biologically based mental illnesses.
We have a lot of children that are trauma victims, and we know how trauma impacts children, and it also impacts their brain chemistry.
No matter the cause, officials say there's no denying that the need is there.
Mental health conditions are something that stay with you. They are not something that you turn off and on, and they have to be treated just like you would any other type of medical condition.
And officials say the earlier kids get the help they need, the better.
We're able to really reduce those problems in adulthood if we're catching a kid at 5, 10, 12 years old. I think that the fact that we're seeing guns coming into an elementary school speaks to that. Kids are doing behaviors now that 10, 15 years ago were being done by adolescents and teenagers. And so we're realizing that, if we're not catching it, that we're going to continue to have these problems that are impacting communities.
Problems that counselors say awareness can help cure.
The more that we can destigmatize mental health, the better that we're going to function as a community.
A final decision on the day treatment program has not been made. However, school officials say they will continue to work closely with children and families in need. A contract with Coastal Horizons for mental health counseling services will be presented for renewal during board committees on Tuesday. Live in the studio tonight, Caitlin Stansel, WECT News.